Today on Investigate TV Plus, one mother's fight to protect her special needs son. I'm Lee Zurich.
And I'm Tisha Powell. Her fight for change after she says he returned from state-supervised care with multiple injuries.
There's a bruise on his leg from a year ago that will never go away, I guess. It's around, I could count the kid's molars.
We speak with those pushing to improve care for special needs children.
Plus, screens were essential for education during the pandemic, why doctors are now blaming them for a growing diagnosis among children.
And it's a loss many women experience, but few talk about.
It's kind of a silent grief, which I think is nonsense, and we need to change that.
Meet the women inspiring others to heal after a traumatic loss. In-depth stories that inform and inspire. You're watching Investigate TV Plus.
According to the CDC, nearly 1 in 5 children in the U.S. has a special health care need.
And parents of children with disabilities say finding childcare can be a challenge. The Center for American Progress analyzed early childhood program data from the federal government. The analysis revealed that between 2016 and 2018, 34% of parents with disabled children found difficulty finding childcare, compared to 25% when it comes to non-disabled children. In addition to private care, some states oversee child health care facilities or group homes that specialize in children with disabilities.
One South Carolina woman is searching for answers after she says her son returned from state-supervised care, battered and bruised.
Nick Ochsner investigates and speaks to an advocate and a lawmaker working to change the system.
Say hey, mamas.
Hey, buddy.
Beth Hodge's world revolves around her son, Jack.
Can I look at this with me?
No brown bear.
Okay, no brown bear right now.
Minutes, hours,
Put your pieces in.
days spent in the family's living room, making sure Jack gets the care he needs.
Hi, buddy. Thank you. Mwah. I love you.
But there's a time that wasn't the case, when Beth trusted other people to care for Jack.
I must be his voice. As that voice and as a desperately concerned parent for all the reasons I've outlined.
That's when this worried mother knew she had to speak up.
As his advocate, parent, and only voice, I'm asking DSSN and the state of South Carolina to find or create a safe residential location for him.
Attached to that letter was this collage showing the bruises, bites, and broken bones Jack had suffered at the group home where he was living.
He needs to have the basic fundamental safety, emotional security, and stability, free from the fear of attack and assault, and get the education he deserves. There's a bruise on his leg from a year ago that will never go away, I guess. It's around, I could count the kid's molars. There's a bruise on his ankle that it just will never heal.
Jack was living in a home under the supervision of the South Carolina Department of Disabilities and Special Needs. The state agencies responsible for making sure people like Jack have the care they need at home or in a facility.
It's been a constant fight to get people to pay attention, to respond to emails, and just to call me back.
Jack's story is appalling. Our state should be incredibly embarrassed.
Kimberly Tissot is president of ABLE South Carolina, a group that advocates for people with disabilities.
This is an issue, and there's a lot more Jacks in the community.
How can anyone trust that their loved one's going to be safe?
There's no trust at this moment.
DSSN isn't just under fire from advocates like Tissot. A report from the South Carolina Legislative Audit Council found a list of problems, including inappropriate spending and DSSN commissioners using their positions to get special treatment for family members.
Well, in South Carolina, the state of services is dismal.
State Senator Katrina Shealy chairs the committee pushing to reform how the state cares for people like Jack.
And the only way that we're going to help people with disabilities and special needs is to get rid of that commission, put somebody in charge of that, of disabilities and special needs, and make them accountable, because there is no accountability right now.
And so if you, as the lawmaker, as the overseer, says there's no accountability, how is there ever going to be accountability unless the system changes?
There won't be. I mean, we have to change the way the system is.
Shealy's bill to reform the agency easily passed in the Senate, but is stalled in the state House.
What are you afraid is going to happen if the current system doesn't change?
we're going to continue to not serve the people of South Carolina, and it's only going to get worse.
Barney.
You watching Barney?
Jack is home with his mom now, but only after spending weeks in a Charlotte emergency room. He had nowhere else to go, and for a time, the state wouldn't approve care workers to help Jack at home. The state wanted to send him back to the facility where he was injured over and over.
Jack to them, I think, is a number and a case and not a person. Otherwise, someone would have paid more attention sooner.
Until that happens, until the state of South Carolina agrees to give her son the care he needs permanently, Beth Hodges says she'll keep fighting.
There's a lot locked inside that little boy, and he's a real person with likes and dislikes. He loves Barney and the Wiggles.
Not this one.
He loves his mama. He's a real person. I love you. Can you give Mama a kiss? Give Mama a kiss. Give Mama a kiss. Thank you, baby. I love you.
The South Carolina Department of Disabilities and Special Needs didn't sit down with us for an interview. It did release a statement saying in part, quote, DDSN remains committed to the safe and quality care of those who rely on our services. We appreciate our providers for their service, as well as the families who voice concerns, so we can continuously improve service delivery in South Carolina. A resource for any parent looking for childcare, childcare.gov. There you can search for providers in your state, and it ensures only providers that are licensed and fully legal are listed.
Our investigation takes us from group homes to the classroom, where every child with a disability is guaranteed access to a free education with appropriate accommodations. But we found qualifying can be a huge battle depending on where you live.
It's supposed to be uniform. It's supposed to be services that they are entitled to have, nationwide.
We reveal the big differences in special education policies across the country and the real-life impact on families. Watch the full story on InvestigateTV.com. Just search Unequal Education.
Still ahead, Blakeleys Breath of Life, how a mother keeps her daughter's memory alive by helping women facing a similar loss.
It's always been a goal of mine is to, make sure that her name will not be forgotten.
Plus, more children are being diagnosed with an irreversible condition. How you can spot the signs in your child before it's too late. It's an eye condition growing so quickly, doctors are calling it an epidemic. We're talking about myopia, or nearsightedness. According to the American Academy of Ophthalmology, half of the world will likely be nearsighted by 2050, and that includes children.
We talked to eye doctors who say time spent indoors on screens is contributing to a rise in myopia cases in young people.
They also reveal the new strategies coming into focus to save your child's eyesight. Jackie Dominguez works as an eye doctor's assistant, but her most important patient lives at home. Her daughter, already wearing glasses before COVID, started having even more trouble seeing.
And so she was at the point where she could no longer go a normal day without wearing her glasses.
Dr. Rebecca Sanders, an optometrist in Waco, noticed the rapid change in vision for many children post-pandemic, mainly an increase in cases of nearsightedness or an increased progression of the condition.
And they come in after COVID and bam, we've changed 3 years worth in only a year.
A dramatic change, Dr. Sanders says, was likely due to an increase in virtual learning during the height of the pandemic. According to a study published in JAMA Pediatrics, the amount of time kids spent looking at televisions, computers, and phones increased by 52%. But even though kids are back in the classroom, the screens haven't gone away. A separate JAMA study revealed children's screen time post-pandemic remained elevated even after COVID precautions were lifted. Ochsner Health optometrist Dr. Danny Tran says an increase in up-close viewing can lead to changes inside the eye.
So essentially what happens in the eye when you're nearsighted or you're myopic is that the eye is growing and it's getting longer. And a longer eye, what you'll notice is that you can see up close, but you won't be able to see far away.
A condition that is irreversible and can lead to more serious vision problems down the road. Dr. Tran recommends parents offset screen time by getting their kids outside in nature for around 90 minutes a day, a nice break from their devices.
The thought behind that is it can offset some of the up-close work and the demands, because a lot of learning nowadays is, online and on the iPad.
What is it about being outside?
So that's a good question. There's still a lot of research that's being done on that, but the idea is the sunlight can help increase dopamine production, and that has been shown to potentially slow myopia progression.
If outdoor distance viewing is not an option, Dr. Tran says consider the 20-20-20 rule.
For every 20 minutes of prolonged computer work, take a 20-second break by looking 20 feet off in the distance, and that will help your eyes relax and reduce some of the eye strain.
Experts we spoke to said children may not tell you if they're having trouble seeing. The Mayo Clinic says to look for the signs of vision problems such as headaches, excessive squinting, turning their head to the side, or a short attention span. It's best to get a myopia diagnosis early.
The idea is the younger you are whenever you're myopic or whenever you're diagnosed with myopia, the higher your prescription will be in adulthood. So we'd like to catch it as quickly as possible, and if progression is noted, we'd like to kind of prevent the progression as much as possible.
Jackie Dominguez enrolled her daughter in a myopia treatment plan called Treehouse Eyes, aimed at preventing myopia progression. Their protocol involves using special contact lenses to be worn during the day or overnight, or prescription eye drops.
I think she realizes that it's helping her, and so she doesn't want to miss like a night's worth of drops.
Or the many more years to come of seeing the world through a healthy pair of eyes. Dr. Tran suggests if you suspect any problems with your baby's vision, get their eyes checked within their first 6 months. He also recommends an eye exam around 3 to 4 years old before they start school. And if you are diagnosed with myopia, be sure to see your eye doctor once a year.
Still ahead, we introduce you to a college student from a small island making a huge difference.
I want to inspire other Americanesians to do what they can to kind of move up in society and upward mobility as a group.
Plus, a place to heal from a physical and emotional pain many women endure. How this yoga studio is part of a much bigger effort to help women facing a traumatic diagnosis.
We want to start with a warning. This is a story about pregnancy loss.
According to the CDC, a pregnancy loss can occur at any time up until delivery. The agency defines a loss before the 20th week of gestation as a miscarriage. The College of Obstetricians and Gynecologists says it's the most common type of pregnancy loss. Up to 20% of known pregnancies end in miscarriage. The loss of a pregnancy after 20 weeks is a stillbirth. The CDC estimates about 21,000 babies are stillborn every year. Both can cause lasting physical and emotional trauma.
As reporter Heather Graff shows us, many women who have endured that pain are now helping others heal.
I think it's amazing to kind of turn our loss into something beautiful.
Tara Barnes' path to motherhood wasn't an easy one. Her first daughter, Blakely, was stillborn at 36 weeks.
Something that a lot of women don't talk about is just miscarriage and stillbirth in general.
So she's helping other parents through the grieving process by donating bereavement boxes called Blakeleys Breath of Life to her hospital in Owensboro, Kentucky.
I have a Polaroid of my baby that I lost, and that's all I have. And with time, those things fade. Footprints are not going to fade. Casting is not going to fade.
Chances are you know someone like Tara. According to the CDC, about 1 in every 175 births are stillborn, a loss Chelsea Levis felt in 2014.
So this is my Timothy bear. It's 8 pounds, 11 ounces, and there's very few items you'll pick up that are the exact weight of your baby.
She helped start Empty Arms Vermont in 2021. The Weighted Bears, a part of this pregnancy loss care package the group gives out to grieving parents.
Often when you go into your provider for early loss, you find out your baby has died. You're just in shock. Everybody will internalize it differently, but often you leave and you just feel like, what now? What do I do? And so the support bags are a way to just extend love to that person.
The group's mission is offering support, both in person and virtual, where you can share your grief with people who just get it.
There has been very little conversation about pregnancy and infant loss. It's kind of a silent grief, which I think is nonsense, and we need to change that.
For families at Tri-Health hospitals in Ohio, that journey will soon start here. The Angel Suite, a private space for families to mourn.
So for these parents, this is, maybe a few days that they get to spend with their baby. So we want to make sure that they get to make the most of that time.
Staff tell us the rooms will be outfitted with items parents can use if they choose, like rocking chairs, a changing table, and a cuddle cot.
It just looks like a normal bassinet that you would have, in the hospital.
The cuddle cots cool the baby for preservation.
But if you put your hands on here, you can feel that it is actually cooling, so this mat cools.
Allowing families the gift of time with their angel by their bedside in an area away from the labor and delivery ward.
Takes them away from those areas of the hospital that, trigger what's going on for them.
Back in Vermont, Kendra Green's passion for yoga came from the pain of a miscarriage and then a stillbirth.
When we do experience something traumatic, our bodies hold a lot of that tension. It's our sympathetic nervous systems kick in, which is our fight or flight, and our muscles just immediately contract. And so we hold a lot of that tension in our hips. That can really relate to our shoulders and back, headaches.
Since her pregnancy losses, Kendra teamed up with Chelsea and Empty Arms Vermont to offer free yoga classes for mothers grieving a pregnancy loss.
Yoga just sort of helps, the movement side really helps with breaking up some of that tension.
Whether it's a yoga session or a bereavement box.
It's always been a goal of mine is to, make sure that her name will not be forgotten, and I think we've done a good job at doing that.
The hope from all of these women is that others who endure a similar loss don't have to do it alone.
By coming to this community, you see that you're not alone and that there are a lot of other people that are walking through the same journey.
For resources on pregnancy and infant loss, you can head to missfoundation.org. It's an international nonprofit that offers 24/7 moderated support groups. It also offers in-person support groups in certain areas and a network of experts trained in traumatic grief.
Still ahead, meet the college student helping others who speak his native language.
There is a very negative stigma that surrounds them, and personally, I want to be able to change that stigma.
How he's also making history for the Micronesian islands.
During the nuclear arms race of the 40s and 50s, the U.S. military conducted 67 nuclear tests on remote islands in the Pacific Ocean. As compensation for the loss of life, health, and land, the U.S. wrote a series of treaties called the Compacts of Free Association, also known as COFA, which allows the people native to these islands to live and work in the U.S. without a visa. Today, 15,000 Micronesians live in Hawaii, the largest Micronesian community in the U.S. However, even decades later, many Micronesians still face barriers on the Hawaiian Islands.
Reporter Allison Blair introduces us to the first ever Micronesian to attend Columbia University and shows us how he's giving back to his fellow islanders.
In downtown Hilo, near the Mo'ohea bandstand, volunteers with the Hope Services Street Medicine team spend their Wednesday afternoons building connections with people who are often avoided. Ed Yichi knows firsthand what it feels like to be the odd one out.
I was being teased, insulted for where I come from.
While the 20-year-old grew up in Hilo, English is his second language.
We spoke Chikese at home, and then I learned English after.
He says his parents migrated to Hawaii Island in the 1980s.
They came from Truk, Micronesia. They were part of the first wave of Micronesians during COFA. There is a very negative stigma that surrounds them, and personally, I want to be able to change that stigma.
Yichi believes that change starts with communication.
I think that's the thing. I think our community, they're very uncomfortable speaking with other people, and that's where I come in, where I can step in and be able to be a bridge.
Hope Services agrees. It's why the nonprofit has been hiring people from the Micronesian community to work in its shelters and on outreach teams. Yichi's ability to translate allows the Hope Services street medicine team to connect with people they otherwise wouldn't be able to communicate with.
He sleeps on the ground, he stays around here, basement area.
It's hard to say exactly how many COFA migrants are homeless in Hawaii. Much of the data is old. According to a Department of Human Services report released in 2015, close to 10% of Hawaii's Micronesian population are either living on the street or in a shelter, a total of 1,150 people.
He says he doesn't really sleep much and chaotic in his head, leg pain, back pain. It was sad at first because he wasn't able to communicate that, and they thought that he didn't want help at first. And I stepped in, that's when he told me he would appreciate help.
While Yichi is still deciding if he wants to pursue a career in medicine or law, he's adamant about using his skills to help the people of Hawaii Island, showing them that even in the lowest times, there's always hope. You've just got to push hard enough.
I want to inspire other Micronesians to do what they can to kind of move up in society and upward mobility as a group.
Sometimes you just have to have people to break down those barriers. This case, language barrier, but just all sorts of barriers so you can help people that need that help.
And what an impressive kid. I mean, deciding between law and medicine, he's got a big future ahead of him.
Yes.
All right, that's it for us on Investigate TV Plus. I'm Lee Zurich.
And I'm Tisha Powell. Thanks for watching. On the next Investigate TV Plus, there's a shortage of Black doctors across the United States.
In the 2020s, to be a first is very sobering.
We examine diversity in the doctor's office and the efforts to recruit more providers who look like their patients.